Hello there and welcome to the Clinical Radiology Department. You're probably viewing this video because you have an appointment for an MRI scan at the hospital and you'd like to find out what's likely to happen when you arrive. Well, first things first. We carry out scans like the one you're about to have many times every week, and we understand you might feel a little apprehensive about it. But don't worry, it's a very straightforward process and you'll be well looked after while you're with us. The first thing you do is find the X-ray department reception desk and let us know you've arrived. The reception staff will invite you to sit down in the waiting area until you're collected by one of our department staff.
McClay. Hi, just come this way, please. Okay, just up this way.
The first thing that happens in the MRI department is that you'll be asked a few straightforward questions about any past medical procedures that might affect the scan. It's very important for us to find out whether you have any metal implants, stitches for example, or a pacemaker, as these require special precautions.
The scan today, so I'm just going to do that with you now. Okay? Now, okay. Right, Mrs. McClay, we'd just like to use this cubicle in here, okay? Now, what we'd like you to do...
You'll then be taken to a changing room and asked to change into a gown.
Okay. Put on one of those gowns that's behind you there, okay? Put all your belongings in that basket that's on the bench. Now, Mrs. McClay, we'll get you to lock your valuables away in this locker.
Once you've changed, you'll be invited to put any personal belongings into a secure locker. Gold items such as wedding rings and necklaces are fine to keep on, as the magnetic scanner does not affect them.
Okay, I'll just lock this, let you see that it's locked away safely, okay?
My wedding ring?
Yeah, they're fine. As long as they're gold, platinum or silver, you'll be fine.
That's fine.
Now, take that key with you, that's safe to keep with you, okay?
Once you've done that, you're taken through to meet the radiographer, the person who's in charge of taking your scan.
Okay, just through here.
The radiographer will want to confirm the information you've already given, so bear with her, it's for your own good. Again, it's very important that we are sure you don't have any metal objects or implants that could be affected by the scan.
So you've nothing else metal in it?
No, just the key.
That's okay. Now, can I just double check? You've had surgery done, but it wasn't done very recently?
No.
You definitely don't have a pacemaker or any artificial heart valves?
No, I don't.
That's okay, that's all fine. We're safe to carry on. I need to get you to pop onto the scale before we go any further with it. Our scanner's going to work some things out from your weight.
When you're being scanned, it's sometimes necessary to have a special fluid called a contrast agent injected into your arm.
Contrast agent, so I'll need to pop a wee cannula into a vein in your arm.
This is necessary because it enables the images that the scanner takes to give the medical team the best information possible in order to reach a proper diagnosis of your condition.
Okay, so let's just have a wee look. And if I could just ask you to open and close your fist for me.
To do this, the radiographer will insert a tiny tube, called a cannula, into your arm. This is a simple process, just like having an injection, and it's over in a few moments.
The needle part comes out, and it's just a wee plastic tube that's left in your arm, but that will stay in until we finish your scan, okay?
Can I still drive?
Absolutely, you can carry on as normal afterwards, okay? Now this one just might be a wee bit stingy.
Now it's time for the scan, and you'll be taken through to the scanner room. The machine itself can look a little daunting at first, but it's perfectly safe, and the way it helps the medical staff to help you is really nothing short of a miracle. These machines are at the forefront of medical technology, and so it might be comforting to know that you're receiving the very best medical attention available while you're with us.
Once we've got to that, the scan itself only takes about 20 minutes. Okay, I'll ask you to come and lie up on the table here.
The scanner is shaped like a big donut, and you'll lie on a special table that slides a little way through the middle while the pictures are being taken.
Lift your legs up for me. This will make your back a bit more comfortable.
Remember, if there's anything you'd like to talk about, please don't be afraid to ask. The staff will be happy to answer any questions you might have.
I'm just going to lift this table up a touch higher, okay?
The cannula in your arm will be connected to a pump that the radiographer can operate remotely from her seat at the control desk. This will introduce the contrast agent at the right time so that the pictures will show up all the details the medical staff need.
Okay, so that's that on in position now, okay. Now we'll put this camera onto your tummy. Alright. Now you're lying on some cameras.
In order to take the pictures, a special lightweight camera may be placed on your body. It's held in place with small straps, but isn't at all uncomfortable.
Cut down the noise a little bit. You'll know
The scanner is quite noisy when it's working, so the radiographer puts headphones on you in order that she can talk to you through the procedure.
loud, constant banging, tapping noise, but that is normal for this machine. That's just how it works. Okay? This is your contact buzzer with me. If you need anything at all,
You'll also be given a button to hold so that if you feel you need help during the scan, all you have to do is press and someone will be there with
down
you.
the noise a little. Alright. But you'll hear all the breathing instructions through the headphones. Okay.
The radiographer will then go to the control desk and start the scan. A typical scan can take up to 20 minutes to complete, and during this time you'll be occasionally asked to hold your breath so that a crisp image can be taken. It's not for long and you shouldn't have any problem with it. The table you're lying on will also slowly move as the images are being taken. You won't feel anything as the scan takes place, so much so that some patients have even been known to nod off during the process. The images that are taken during the MRI scan will help the medical team to visualise what's happening in the blood vessels and organs within your body. This will enable them to reach an accurate diagnosis of your condition, so that they can decide on an appropriate treatment.
Well done, and that's your scan all finished. I'm just coming straight through to bring you out.
After the scan is complete, the radiographer will help you from the table, and once the cannula in your arm is removed, you'll be able to get dressed and go home. You can even drive if you need to.
Kidney measure 7.6 centimetres.
A little later, a specialist will examine the images from the scan and the results will then be passed on to your doctor. Our aim is to make your visit as comfortable as possible. If there's anything you'd like to know, please ask any of our staff and we'll be very happy to discuss things with you. We're looking forward to meeting you.